okay, there's the screening. I want to push it further. Are there free vaccines?
Well, that's what we were lobbying for.
Okay.
So we've been lobbying for the longest time because don't think about the marketing, don't think about the companies, just think about the benefit because we have studies to show and we have studies done in the Philippines to show that it's a very efficacious vaccine. And if you think about it, and Mrs. Rose here would agree with me, it's a very expensive disease to treat. Okay, so we did a survey. If you go through chemotherapy and radiation, it can reach from 180,000 to 400, or almost $500,000.
$500,000
Okay, so
If you get the vaccine,
yes,
though.
if you get the vaccine, that will prevent.
And if you're working,
disease.
if you have a source of income,
Yes.
it's like...
So it's very affordable, especially since, imagine, because we do see cancer patients every day and they ask us, what could I do, right? So imagine if you can afford, or even try to afford to prevent having cervical cancer, then you'll do it. So why not invest?
Yes,
It's just
in
a little
yourself.
amount and you prevent disease from happening.
I'm looking for at my friends. Let's just give a figure out there. It's for the whole thing, about 0, 6, and 1 year.
016. So
016.
016.
But if you all in it, less than 4,000 ba?
No,
No,
10,000 tops plus or 2,000.
Yeah.
So 10,000 pesos.
But that's in a year, in a span of a
investment
year.
in 6 months.
6 months.
I
And then a year.
actually had this talk with young kids, not young kids, but teenagers. And I was telling them, we were computing, and this is a group of students, and I said that it's even cheaper than buying buying coffee or frappuccino in your every day.
Mas mahal pa yun.
Mas
Mas mahal
here,
pa.
in Starbucks. So really, they buy coffee every day. They
Why don't
pay
you
for
go to your
food
doctor?
every
Oh.
day. But if you prevent disease, it's just less than that even. No? If you just save your baon every day, or even for mothers, if you can prevent disease, that's a lot better. So it's something affordable.
Absolutely. So, or if not, set aside. It's for you. Well, it's not just for you. It's for your families, for the people around you. Before I let our ex-team, Dr. Irwin, of course, also, it's for everybody. It's the fact that you're thinking of the future now. The end goal is, I'm going to borrow the phrase from the organization of Miss Abby, you do want a cervical cancer-free Philippines. So the end goal is to turn it into a law or a reproductive health bill. Are we going for that? What's the end goal?
The first end goal is to get a national program because it's still screening and vaccination.
National screening program first.
So
Will that mean
with the new
schools?
administration, maybe.
Will that mean schools or offices?
For all women, because when you screen, that means that you do the test for all women, so that you catch the disease or the pre-malignant. So because cervical cancer, aside from knowing what causes it, the other thing is we can detect with a pap smear. It's just uncomfortable, but not painful. If you have a pre-malignant, so before it becomes a tumor, before it becomes a mass, you can detect it. No? So when the cell is abnormal, no mass yet, it's just a cell, then we can already do something. So that's why we want the screening
First.
and vaccination. So hand in hand, it will help.
Yes, Dr. Irwin.
Well, that's what the Society of Infectious Diseases, particularly taking care of women and women during pregnancy, especially right now. So that's what we've been stressing. With infection, we want prevention. Okay, and we could only get prevention through screening and vaccination.
Okay.
I think what we're trying to do here is that what we're trying to say is that our voices are all small. Patients, advocacies, doctors, private organizations. But what we need really is a very strong stand for the Filipino.
A unification.
A unified stand for the Filipina. The Philippine OBGYN Society is trying its very best to educate the lay. Okay? We need your help. You need to come forward and you need to help us also protect yourself. Currently, there is no national government program that will stop cervical cancer. The message at the end of the day is that cervical cancer is caused by a virus. Okay? This virus is associated with sexual activity. And we would like to prevent the viral infection by vaccination. And if you are somebody who has had sex or who has had the risk in developing the cancer, then we would like you to be screened. Protect, screen. We need the government to do that. But right now, if the government is not going to do that, then you must do it for yourself.